Afternoon, folks. That's Saturday, 31st of May, 2025. It's about 25 past 5 p.m. And we got a hot one today. Beautiful day. The weeds are coming along here. Maybe you can see them. Wishing he's doing, but I'm expected to do it. Well, I've been doing it the last 3 years, so I'll be having 3 years off. It's the neighbours ghosting, stopping down the road with his daughter. Not temporarily, for months and months and months. Seems to be under the impression that I'll be going somewhere, moving. Or somebody tries to get rid of me, the longer I stay. And I've decided I'm going to stay there. I'll take you for a spin on this beautiful day. I ain't going to the shops here. I like to have a little drive out. There's one about just over a mile away. It's a quiet little shop. Don't get many customers in there, so I'm going to go there. Oh, I can smell weed from somewhere. Somebody's having a puff. What is that behind the wheel? This is Prince's End, Tipton. This is the Wednesbury Oak Road. You're probably familiar with this road. A bit of a S-bend here. The beautiful trees, lovely. He has done the right. Private housing estate on the left. I used to live there. I lived there for about 18 months. Flat, ground floor flat. Should have stayed there really. Tipton Sports Centre on the right. Football club. The Gospel Oak pub on the left. Never been in there. This is Gospel Oak, posh part.
I think I don't nobody is pretending that they are completely accurate, and I think that's when it comes into slightly more dangerous territory when people are being historians, as I'm sure David will tell us, and then they have a little bit more of a burden of responsibility, I would say, as a TV critic who likes to be entertained.
And David, is there a danger that audiences come away from a drama with a reading of history that is wrong, or is it good that they're watching
Lee Muckroad
and develop a real interest in
in towards Wednesbury.
I think it's very much the latter. I think people understand
She's,
when they're watching a drama or watching a film that is set in the past that they're watching a creative and imaginative
10 mile
piece of
ahead.
cultural output. They're not reading a history book. But the most important thing is it is a gateway drug. People watch television dramas and films, and that inspires in them interests in historical eras, historical things that they then go on to expand by reading books, by listening to podcasts, by going to museums, and engaging in history in all the ways that we do. We are incredibly fortunate in this country in that we have this national passion, almost a national obsession with the past. The National Trust is our biggest membership organisation. Our top tourist attractions are ancient cathedrals, museums and galleries and stately homes. That passion is in many cases directed and shaped by people's first encounter with historical figures in eras, which is in dramas. And I think people understand that those are based on real figures, based on real events, and they're not a representation of real events. But I love a history.
Are the pellets
that
there?
We are a nation that wants historians involved, like Harry was involved in.
There were some money out there second hand.
And Lady W, based on her book. They want historians involved. We want authenticity and accuracy because it makes the storytelling better and the experience richer.
Thank you both. We are so
The old Bill.
Historian Professor David Holshaw and entertainment journalist Caroline Frost. Thank you. Studio direction today was Melanie Ruff. Our producers are Josh Jenkins.
Yeah, roadworks.
Our editor Luke Metz.
Oh, I don't know what they're doing here.
Rest of the weekend.
They look very
Saturday
suggestive to
PM was
me.
presented by Caroline White. Now on Radio 4 Political Thinking with Nick Rollins.
Barcelona, Atlanta, Sydney, Athens. My guest this week on Political Thinking won gold medals at all over her career. She won
Shops just on the left there, but I got a park on here.
Tally Gray Thompson, Baroness Gray Thompson, as she's been for the past 15 years, has said she loves being
No
in the
one
House
works
of
here at the
Lords
weekend.
more than she loved being an athlete. Since one of Britain's most decorated Paralympics gave up wheelchair racing,
Hey.
she's campaigned for the rights of
Love
disabled
it.
people, and now finds herself at the centre of two of the most high-profile debates in Parliament: the debate about saying whether to welfare benefits for disabled people.
Back. It's got a bag of stuff in: milk, tea bag, sugar, milkshake, hula hoops, bickies. Put them in the back here, out of the sun. We've got the milk there as well. Direct sunlight on the milk. Quite a little shop that. Tucked out the way.
Disabled who gets PIP, and
And this
That's
paper
better.
which the government's talking reform.
yeah, and that's led to individuals, experiencing an increase in hate on the streets. People being told
It's a little private car
people
park,
like you
this.
shouldn't be around, you're taking money out of the state. And I
With
think
no
it's
one here at the
complicated
weekend.
because 2012 was the most amazing Paralympic Games ever. But I do get frustrated when non-disabled people say to me, well, that changed the world. Because there is still discrimination in healthcare, education, housing, public transport, employment for disabled people. And there's been bits of shifts, but it hasn't been enough. And so the fact that only
This
50%
roadworks
of
look
disabled
daft.
people who
Can't see what they're doing
are in
there.
a job because of
This is a
discrimination.
big, massive
That shows how
manhole
much
cover
further
missing
we
the
still
summit.
have to go.
Liz Kendall is the professor said recently millions of people who could work attract.
Oh, 53.
Respect that we know that good work brings.
Ernie, number 53.
To say, isn't it?
So I agree with that. It's
Your
then
time's
what
up.
happens next and how it translates into a more public view.
We've got a
of,
green light
disabled
anyway.
people are costing too much and they're not valued in
Tiny
society.
little
And
traffic
it's how it
lights, man,
translates,
roadwork.
I guess to the word on the street and into
This
other
is all
news
it is
headlines
here.
and other discussions.
What could you do? What could other ministers do if they want to have a debate about reform?
Unless these lights are out.
Say, look, to have more
There's nothing I can think of.
classify them as disabled.
Those
Let's be
pedestrian
clear, we're not
lights.
talking of 1 in 10 people being disabled in the way that
you are born with spina bifida, means for those people, the spine is one cord didn't fall properly and meant wheelchair bound, not straight away, but for ages. Then we're not talking purely about people with that sort of disability. So what could they do differently?
So we absolutely need to reform the system because it is not sustainable. As a country, we can't afford to keep going the way we have. And over the years, personal independence payments expanded. And, you know, when you look at the number of young people that are on benefits, you know, that can't be good for us as a nation. But it's how you change people from being out of work into work. And that's the hard bit to fix because public transport needs to be more accessible. We need to have more than just, you know, tick box compliance. There's various different schemes over the years about getting disabled people into work. Actually, companies need to do it and actually employ more disabled. There has to be meaningful jobs as well, and that's another challenge.
In some ways, the message from Telegraph's it's about support and advice to people to help them as you can get job. What it isn't about is just cuts.
Yeah, and I lost a philosophical argument back the last time we did welfare reform, which was about, can you change the system to show if you get benefit, what can you do with it? Because there's lots of ways to contribute to society, whether it's volunteer, you know, just it doesn't necessarily have to be paid work. But unfortunately, that doesn't fit into a nice, easy system. So you have to prove what you can't do, and then that actually leads to people not doing things.
You've made a link between this debate about benefits and the other big controversy working its way through Parliament. It's coming your way, in other words, towards the House of Lords having had the votes in the House of Commons, and that is assisted dying. What is the link between that rhetoric you dislike about disabled people and the way to make the system?
So if life is so intolerable for disabled people, and this, you know, bill passes, there will be disabled people who think the only choice is to end their lives. And every jurisdiction that's brought in a law has changed, has expanded or changed the jurisdiction of whether you're a resident or not. I mean, it sounds brilliant, you know, terminal illness, 2 doctors settle wish. The devil's in the detail.
Yeah, to be clear, the current bill says only if you're told there is some evidence that you've got 6 months or less to live. And then, as you say, there's a process. Now, in theory, that doesn't affect disabled people at all, does it? Unless they're disabled and happen to be terminally ill.
Well, we think of terminal illness as cancer, leukemia, but actually there's loads of conditions which could count as terminal. So if I got a pressure sore and it didn't heal, I could very easily be given a terminal diagnosis. I've had friends who've died from pressure sores. So it's how it gets used in practice, and that's the worry, because if your choice is, if you have a carer, you have 15 minutes in the morning to either change your incontinence products or eat, then actually life becomes absolutely intolerable. And for me, you know, I'd be dead if it wasn't for the NHS, absolutely. And I want to protect it for my daughter and future generations. And I can see very easily with the level of coercion that is around, that if somebody said to me, do you want to save the NHS? Yeah. You know,
that pressure that someone can put on.
And very low level. It doesn't take an awful lot.
You're a burden.
And
there's a lot of money going on here.
Yeah, do you want to do this? Or,
is your life that good?
Yeah. And I've had people say to me, if my life was like yours, I want to kill myself. Yeah. Multiple times. And
do they mean it abusively? Do they mean it thinking that they're somehow being empathetic? I say it's an extraordinary thing to say.
Yeah, I think it's because people have this view of disability and impairment, that it must be like the worst thing in my life. I mean, I've had somebody say to me, if I was incontinent, I'd want to end my life. So I'm incontinent, I have to catheterise. If I don't catheterise, I won't myself. It's not the worst thing in my life, but it's that image of what could be the worst thing. And then this comes back to the rhetoric of disabled people, you know, poor life, don't contribute. It all keeps going in circles, and it's kind of very much under the radar, but it causes lots of problems.
Now, you of course have lived with this knowledge of your disability. That mentality that enrages many disabled people and obviously saddens them massively, which is it'd be better if you weren't here. Did you have that as a child? Did your parents even have to confront that conversation of, would it have been better if?
Yeah. So I was 5 when the first person stopped me in the street and asked me why my parents hadn't aborted me.
On a lighter note, that's your lot.